Hello, everyone. I'm Yaren. I'm a Ph.D. candidate in Industrial Engineering Department at Northeastern University. And today I'm going to be talking about our research on reducing the risk of human trafficking by improving access to housing and supportive services for runaway and homeless youth in New York City. And we are an interdisciplinary team from Northeastern University, WPI, and John Jay College. And our work is supported by NSF. Before starting, I would like to give a brief description of what human trafficking is. Human trafficking is a malicious global rights issue that involves the use of force, fraud, or coercion to obtain some type of labor or commercial sex act from an individual. And studies show that traffickers prey upon vulnerable populations. And who are vulnerable to human trafficking? One of the larger groups that is known to be highly vulnerable to human trafficking is runaway and homeless youth. They are youth and young adults, ages between 14 to 24, living on the streets or without consistent or stable housing. Therefore, they lack the community support structures to protect them against the societal and environmental trafficking risk factors, such as bullying, racism, sexism, emotional or physical abuse or neglect. One study that took place between 2014 to 16 in a large organization, which is known to be Covenant House, in 10 different US cities, showed that nearly 1 out of 5 homeless youth were trafficking victims. And out of these trafficked runaway homeless youth, 62% were trafficked for sex, 23% trafficked for labor, and 15% were trafficked for both. And in this research, our study population is homeless and unstably housed youth and young adults in New York City, ages between 16 to 24. And because New York City has the largest such population in the nation. So we want to be able to help solve this problem. But the question is, how can we be an effective disruptor of human trafficking networks? And it is known that access to appropriate housing for runaway homeless youth is an effective answer to youth's vulnerability towards exploitation. And the reason I'm emphasizing appropriate housing rather than housing is because youth also needs to be able to access important services such as mental health support, healthcare, education, legal assistance, financial assistance, to be able to not vulnerable to human trafficking anymore. And as you could imagine, some of these services are already so hard to access, even if you had the housing opportunity. And when you don't have the access to housing, it's even harder for them to access these services. Also, in most communities in the US, number of youths experiencing homelessness and seeking supportive services is more than the capacity of the existing housing resources. On top of that, organizations might have their own limitations that might make it harder for youth to access these organizations. For example, it is likely that an organization would have an age limitation, or they might just be serving to a certain sexual orientation or a race. For example, their age limitation might be just serving youth from ages 16 to 20. They might just be serving to LGBTQ youth, or they might just be serving to immigrants. Another thing is youth having children makes it even harder for them to access the organizations because most of the organizations are not accommodating children. Having disabilities of history of mental illness makes it even harder for them to access these organizations and services. Therefore, with our study, our goal is disrupting human trafficking networks by improving access to housing and supportive services, such as medical and mental health support, to reduce the supply of potential human trafficking victims. And throughout our study, we are following a runaway homeless youth-informed, data-driven, and systematic approach. I'm saying systematic because we're looking at New York City as a whole system. And the reason I'm saying runaway homeless youth informed is we are going to be surveying 500 youth to learn their needs and wants. And let's look at our objectives. Our first objective is learning the prevalence of those at risk of being trafficked and associated housing and supportive service needs and wants. And this brings out our data collection process. And our second objective is projecting the required capacity to meet these needs. And this brings out our analytical model formulation process. So let's look at our first objective. We have 3 major steps to identify at-risk runaway homeless youth and estimate their needs. And our first step is the survey design. And our goal with that is determining what services and capacities exist in organizations. And our second step is the prevalence estimation. And with that, we would like to be able to determine the size of runaway homeless youth population in New York City. And our third step is using data science techniques such as clustering to create youth profiles to estimate youth's collective needs. So I have talked about the youth profiles briefly right now. And as you can see here in the right-hand side, these are what they're going to look like. And these youth profiles are going to be created based on the 500 youth surveys that we're going to be conducting. And we are going to be identifying collective needs of youth. As you can see in this figure, the columns represent the days and the rows represents youth's needs and wants. When we look at sample youth 1, looks like they need a bed approximately for 180 days. They need low intensity mental health support every other day throughout the time that they're staying. They need medical and dental services, low intensity, twice sporadically, and legal assistance, high intensity, only once. And as you can see, sample youth 2 actually differs from sample youth 1. And these differences changes based on youth's wants and needs. And as just like the youth profiles, we also would like to be able to create the organization profiles. And these are going to be based on 20 provider interviews that we're going to be having. And when I say providers here, I mean the organizations who provide housing and supportive services to youth. And with these interviews, we want to be able to identify the existing resources and capacities within these organizations. This figure is pretty similar to the youth profile. And you can see the columns again represents the days, and the rows this time represents the existing resources. And the gray shaded boxes are representing the weekends, and the X boxes are representing the days that this resource is not available for youth to use. So looks like they have 24 beds available to youth anytime, and they're also offering low intensity mental health support, medium intensity mental health support, and medical resources and high intensity legal assistance. It looks like, well, when we look at the low intensity mental health resources, in total they have 4 employees working, and looks like these 2 are available for youth to use only on the weekdays, and on the weekends they're not available. And when we look at this resource, it is only available during the weekends. So after we create this organization profiles and the youth profiles with our analytical model, we want to be able to place youth to organizations. And our objective is maximizing the overall benefit of placing youth in organizations while minimizing the cost of deploying extra capacity to these organizations. So we call our model the capacity expansion model, which is an integer linear programming model inspired by multiple multidimensional knapsack problem. And we are considering multiple organizations with multiple capacitated services. Another thing that we consider is the stochastic youth arrivals and stochastic stay durations. Another thing is the services that are provided to youth can vary in intensities and frequencies. To make our model more detailed and realistic, they're also considering different aspects of services. For example, a service can be served to youth in a periodic fashion, such as a mental health support appointment. As you could imagine, it is more likely that a mental health support appointment would be weekly or bi-weekly, and it would be every Monday for an hour. But on the other hand, a medical appointment does not have to be served to youth in a periodic fashion, because it just can be any time that they need that assistance. Another thing that we consider is the time windows. Youth might just be able to receive one service within a time window. They might just enter the system and say that I need housing resources, I need a bed, like within these 5 days. Otherwise, I'm not going to be available to receive the service. And the other thing that we consider is services that are provided to youth can be through a single or multiple service providers. For example, again, medical appointments can be served to a youth through multiple service providers throughout the time that they're staying, as long as the doctor knows the history of the patient. On the other hand, it is more likely that a mental health support appointment would be through a single service provider throughout the time that they're receiving the service. Because of the nature of the service, it is more personalized, it is more tailored to the individual. So our next steps include surveying youth and interviewing service providers. We just started surveying youth because the in-person data collection process was delayed due to COVID-19, as you could imagine. And after our surveying process, we are going to be creating youth and organization profiles. And currently we're working on our mathematical model, and we are going to be projecting the cost minimizing capacity to deploy to meet the collective needs of youth. With our runaway homeless youth-centered approach, we are going to be providing a solution that meets the actual survival needs of vulnerable youth rather than presumed. And we are working with New York City Mayor's Office and New York Coalition for Homeless Youth. And we are going to be informing their decisions and policies regarding the effective expansion of shelter services. And it is possible to scale our work to other communities. Here you can see my references. And thank you for listening.